From July to September 2020, the VHA conducted a statewide consultation with our members on the public health sector's response to COVID-19. Capturing a unique moment in time, the consultation represents the breadth of the Victorian public health sector, from metropolitan, regional and rural hospitals to community health services and specialist health services across the state. Here's what they told us. Victorian health and community health services have contributed to some of the highest testing rates in the country. Since January 2020, over 3.6 million tests have been conducted in fixed and mobile sites all over the state. From busy car parks, to going door to door to residential areas, to windswept tents in the rain, rural farm gates and on mountains during ski season. Coordinating this mammoth operation not only involved setting up the testing and screening sites and preparing staff, but it's the result of conscientious planning, foresight and rapid realisation of government directives. Behind the scenes, health and community health services worked vigorously to establish the frameworks for safe screening, testing and crisis response to become essential care priorities. This involved initiatives and programs such as pandemic crisis plans, infection control procedures, staff upskilling and training, and securing procurement pathways for PPE and vital equipment such as beds and ventilators. At the beginning of the pandemic, the sector was concerned about the provision of personal protective equipment, or PPE. Many services also reported on the increased need for staff training in the correct use of PPE and preparedness, including correct donning and doffing and infection control procedures. The public health sector response to COVID-19 highlights the strong relationship the sector has with their communities, as trusted authorities relied on to disseminate the latest information and mobilise the public to engage in screening and testing procedures as part of the new normal. Across Victoria, hospitals, community health centres and multi-purpose services prioritised community engagement efforts, leveraging the broad reach of social media and website platforms to engage with local populations and promote testing, staying at home and the importance of following government directives. COVID-19 has emerged universally as a virus that exacerbates existing inequalities, and the core competencies of community health services have been identified as vital to the COVID-19 response, as they successfully build on established, trusted positions in communities to deliver targeted and tailored grassroots care to Victoria's most vulnerable populations. Community health workers continue to support consumers to navigate through the system in a pandemic by prioritising initiatives that connect with and monitor hard-to-reach populations, such as people with poor internet access, non-English speakers, and those experiencing social and geographical isolation. The unique position of community health services to identify and deliver care to socially and economically disadvantaged people at high risk of contracting the virus was specifically recognised in the Melbourne public housing lockdown response, where community health workers on the ground received positive feedback from the community. The response to COVID-19 has seen the health sector overcome significant challenges and pivot within rapid timeframes to deliver care in new and innovative ways. Some health and community health services have also overcome major barriers such as administrative red tape, funding constraints, and internal cultural resistance to change. Services converted non-essential care from face-to-face to virtual delivery, redeployed parts of the health workforce to maximise efficiencies, and solidified sector-wide partnerships for improved communication, consistency, and integration of infection control and care delivery. This agility has enabled the sector to adapt and embrace more efficient modes of care delivery and virtual operations to meet the needs of Victorians in a crisis. Since March 2020, over 14 million telehealth consultations have been billed to Medicare. Overwhelmingly, telemedicine has become an accepted primary method of care delivery and enabled health services to maintain clinical contact with patients and, in some cases, extend their reach outside their catchment areas to deliver statewide regional support. As a key component of the pandemic response, telemedicine has maintained patient access to healthcare for many people across Victoria. Health providers are supportive of its continued use in a post-pandemic environment as part of a hybrid model alongside face-to-face clinical appointments. Early in the year, most health services overhauled the way their staff conduct their work to expedite flexible working arrangements and direct those who can to work from home. Sections of the workforce who could no longer perform their roles were resourcefully redeployed by agile leadership teams who saw opportunities for employee skill sets and experience to be applied to emerging crisis response work. For some services at the outset, this resulted in greater efficiencies and improved staff satisfaction. Health services reported initial adrenaline-fueled months of high performance and momentum as the pandemic response was actioned across the state. More recently, however, the challenges of delivering healthcare in back-to-back crises from bushfires to COVID-19 has begun to take its toll on public health workers. For some health workers, the strained work environment was exacerbated by the trauma of the aged care response crisis and increased aggression and abuse from consumers and families relating to testing, infection control regulations, and changes to visiting protocols. In some cases, this stress was compounded by increased media shaming. Services faced workforce issues associated with staff furlough and illness, with some leadership teams observing increased rates of leave uptake, such as carers' leave relating to school closures. Most services report that high numbers of employees have worked for months without a substantial break, leading to large amounts of accumulated leave and no backfill capacity to facilitate uptake. Maintaining staffing numbers while complying with infection control measures such as frequent employee testing, isolation requirements following positive cases, and staff outbreak management were also major challenges for some services. Following the second wave of COVID-19 in Victoria, health services are prioritising workforce resilience as they observe increased incidents of staff fatigue and mental health issues. Health services operating in bushfire-prone regions are already contemplating the additional challenges they will face providing care in a pandemic in the lead-up to another bushfire season. Now that restrictions have receded and Victoria enters a recovery phase, public health services are bracing for an increase in physical and mental health presentations previously deferred due to COVID-19. According to some health services, the pandemic has resulted in adverse treatment and care consequences for the delivery of non-COVID healthcare due to government-mandated deferral of treatment and public concern about infection rates in healthcare settings. Beyond elective surgery wait lists, health services reported fewer specialist referrals during lockdown and are now addressing the anticipated increase in demand for social support, family violence and mental health services in addition to deferred non-COVID-19 healthcare. A silver lining of the pandemic has been new and strengthened partnerships and collaboration across the health sector. To address the challenges presented by the pandemic and coordinate an integrated response, many health services continue to rely heavily on one another, leaning on peers for advice and support. Expected overwhelming demand due to the pandemic required health services to adopt a more networked approach to how capacity is planned and shared. This demonstrates the resilience of the health sector to confront even the biggest challenges head-on and emerge with renewed strength and resolve to improve the system for all Victorians.